Hi, my name is Dave Lastman, or Medicare Dave, as I'm better known. I am the proud owner of Senior Healthcare Team. That's www.seniorhealthcareteam.com. And I wanted to make a quick little video this morning shedding a little bit of light on a topic that is fairly confusing to lots of people that are new to Medicare, and as well those people that have been on to Medicare for some time. And this video is going to talk about two things. They're going to talk about how Medicare supplements or Medigap plans work with Medicare to cover your expenses. And we're also going to talk about the fact that Medicare supplement plans are standardized. So what does that mean? I'm going to put on the screen, there's a publication that CMS, the Center for Medicare and Medicaid Services, puts out. It's called A Guide to Health Insurance for People with Medicare. They put it out every year. And if you look at the most recent guide that they put out on page 12, all right, it says Medigap insurance companies can sell you only a standardized Medigap policy. All Medigap policies must have specific benefits so you can compare them easily. So what that means is, once you determine which type of Medicare supplement plan is best for you, let's say you determine that you want Plan G, okay? There's no difference between Plan G with one company over another company. Let's say if Plan G with United American versus United Healthcare versus Cigna versus Mutual of Omaha. The benefits are 100% exactly the same from company to company. That said, each one of those insurance companies can charge you however much they want for that same exact standardized plan. So when I'm working with a client to determine what is the best type of plan for their needs, we go through and we do an assessment of their needs, their budget, their prescription needs, their medical history, and we determine, or I help them to determine for themselves what is the best plan type for their needs, right? So once somebody says, Dave, I want Plan G, then we go in and we look in their zip code. Let's say somebody lives in Fort Lauderdale, Florida. There might be 20 or 30 different insurance companies offering that same exact Plan G. And the rates that they charge you, the monthly premium, can be as much as $50, $60, sometimes over $100 difference between the lowest carrier and the most expensive carrier. Now keep in mind that you don't get anything more for paying more. So once we look into the zip code and we find the 3, 4, 5 companies that offer that plan type for the lowest rates, the other things that we want to compare is the history of rate increase from company to company. Does company A raise their premiums every year historically at 3 to 5%, while another company may have a lot less frequent rate increases? That's really important because nobody knows what a company is going to do with their rates in the future, but the best indicator of what they're likely to do is what have they done in the last 5, 6, 7, 10 years. The other thing we want to look at is the strength of the company. We want a company typically with an A credit or better. And we also want to look at things like customer services. Some companies are notorious for having very bad service, while others may be better. So those are the three things that I look for when I'm recommending a plan or a company for somebody. So that's standardization. Now, the other confusing topic is people get confused when you're used to having group insurance and you have to go to a doctor and say, do you take my insurance? Let's say you have Humana from your employer. You have to ask the doctor, do you take Humana? Are you in the network? When you have original Medicare and a Medicare supplement, the only thing that you have to ask a doctor, hospital, or provider is, do you accept patients with original Medicare? What type of Medicare supplement plan you have, or who the carrier is, has zero indication. Does not have anything to do with the doctors you can or can't see and the procedures that are approved, because Medicare is your primary. That means that as long as a procedure is covered by Medicare, the secondary insurance will pick up the balance. As long as your doctor accepts Medicare, Doesn't matter if they've even heard of your supplement company. They have to accept you and the payment is going to be covered. So you have to keep in mind that when you choose a Medicare supplement plan, Plan F or Plan G, it is a Medicare supplement. It's not a medical supplement. So if the procedure is not approved by Medicare, the secondary insurance is not going to pay. What happens very many times is doctors don't understand this. Their doctor's offices make mistakes. They're used to somebody coming in with a group plan and they just bill that group plan. And a lot of times they make a mistake because the billing has to go in the right order. It has to be submitted to Medicare first, then to your supplemental company. If your doctor sends the bill first to your secondary company before getting it approved for Medicare, it's not going to be approved. And many times I have clients that are confused about this and they think there's something wrong with their secondary insurance company because a procedure wasn't approved. What they didn't realize that the doctor has to send it to Medicare first and then to the secondary company. And there's a real easy way, a lot of times if you just want to find out if a procedure is approved by Medicare, go into Google and type whatever the procedure is and then type Medicare Part B, and typically you'll be able to get your answer. I recently had a client that had a bone density test that was ordered by her doctor, and it was denied by the secondary insurance company. The reason it was denied by the secondary insurance company was the doctor didn't code it properly, didn't send it to Medicare first, and sent it directly to the secondary. So when that happens, you can take a deep breath. Don't freak out. For my clients, I always tell them, call me, and then we'll have the provider resubmit it properly. And then, 10 times out of 10, it's paid without problem. If you have any questions about this, feel free to send me an email directly, dave@medicaredave.com. You can also feel free to leave a comment below this video, and we'll address the comments below. Feel free to also watch more Medicare tutorial videos at www.seniorhealthcareteam.com. Be well and stay safe.